Hey, it's Dr. Yazdan. Let's talk about patient's donor zones and an FUE surgery. This is our patient 6 months after he had an FUE surgery. You can see that's my hand, that's a comb. I'm combing through his donor zone, and you basically cannot tell that this patient had a hair transplant surgery. This is an FUE done right. We've posted plenty of examples of FUE procedures that are not done right, and the scarring and the thinning and the windows that you can see in the donor zone. Now, what I really want to talk about in this video is actually donor zone graft regeneration. What does that mean? Your donor zone is permanent. What you have back here is what you have in your lifetime in a transplant. Now, I had a consultation with the patient yesterday, and he told me that he was talking to another doctor who basically told him that after an FUE surgery, he would get 30% regeneration in his donor zone. And I looked at him and told him that was total BS, because it is. If your doctors are telling you in a consultation that you're going to get 30% regrowth in the donor zone after hair transplant surgery, that is a doctor I would not trust. You can maybe get 5%, maybe at most 10% in certain patients, done by a qualified doctor who's using small punches and not punching very deep. Sometimes you can get a little bit of regeneration through there, but definitely not anything close to 30%. And why is this important? Well, it's important because if you need to have multiple surgeries, your donor zone is very valuable. And by telling someone that they can get 30% regeneration in their donor zone, that means that at the end of 3 surgeries, they could possibly have enough donor density left for a 4th one. And that's usually untrue, and it's very false. So I'm doing this video for people to understand that I think the new thing that is being talked about is regeneration in the donor zone. It's totally false. It's totally misleading. I wrote an article about this. It actually made it into the news years ago. It might have been like 7 to 10 years ago. And you guys can probably find that on Google. And it was about donor zone regeneration and basically a study that I did regarding it. But 5%, maybe max 10%, 30%, no chance. Run away from that clinic and find someone that gives you advice that makes sense and recommendations that make sense. If you guys have any questions, always feel free to reach out to us, and we'll be happy to answer your questions and get back to you. Thanks again for watching.